Welcome to UK Care World, a free learning space for care and support workers across the UK. Here, you'll find courses, tips, and resources in text, audio, and video designed to help you grow in your role and make a difference every day.
Welcome, care and support workers. This is an essential explainer on safe manual handling. The work you do is incredibly important, and making sure you can do it safely is our absolute top priority.
Our goal today is pretty straightforward. We want to give you the knowledge you need to carry out your tasks safely. To protect both yourself and, of course, the people you care for from any potential injury.
And here's exactly why this is so critical. According to the Health and Safety Executive, a massive 40%, that's nearly half of all work-related sickness absence in health and social care, is because of manual handling injuries. That's a huge number, and it's a number that together we absolutely have to bring down.
So, here's how we're going to break it all down. We'll start with the reality of the risk. Then, we'll cover your legal duty of care. After that, we get practical with the 8 principles of lifting. We'll also focus on that unique skill of moving people with dignity. And finally, we'll wrap up with your ongoing commitment to safety.
Okay, so let's get right into it. Before we even touch on the techniques, the how, we really need to understand the why. The risks involved in this job are very, very real, and getting your head around them is the first big step to preventing harm.
First up, let's get 2 key terms straight. A hazard. A hazard is simply anything in your environment that has the potential to cause harm. So think about it. A heavy box, a piece of bulky equipment, or something as simple as a wet floor. In our line of work, a person who needs help moving is also a hazard.
Now, a risk is different. A risk is the actual chance, whether it's high or low, that a hazard is going to cause that harm. So the wet floor is the hazard. The risk is the high probability of slipping on it. Our job every single day is to minimize that risk.
And make no mistake, the consequences of getting it wrong are serious. We're not talking about a little bump or a bruise here. We're talking about significant life-altering injuries, painful muscle strains, torn ligaments, hernias, or even a slipped disc in your back, which can lead to chronic pain and nerve issues like sciatica.
Now, these risks, they aren't just a matter of good practice. They are a legal issue. There are regulations in place, specifically the Manual Handling Operations Regulations from 1992, that clearly spell out responsibilities for your employer and for you. And it's really important to understand that safety is a partnership. Your employer has a duty to avoid hazardous tasks wherever they can, to assess the risks that can't be avoided, and to reduce them. Your duty, your side of the bargain, is to follow the safe systems they put in place, use equipment the right way, and crucially, report any hazards you see.
So, the big question is, how do you do your part? How do you assess risk on the spot when a situation changes? Well, the Health and Safety Executive gives us a really simple and memorable tool for this. It's an acronym, TILEO. Let's start with T. T is for the task itself. Before you do a single thing, think about the movement. Does it involve twisting your body? Bending down really low? Does it require a lot of pushing or pulling? Any of those things put a whole lot more strain on your back.
Next is I, for individual, and this one is about you. Ask yourself honestly, am I capable of doing this task right now? Do you have the right training for it? Are you feeling 100%? Or do you have an old injury that might act up? Being honest about your own limits isn't a weakness, it is your greatest strength.
L stands for the load. In our work, the load is often a person, but it could be anything. So you have to ask, is it heavy? Is it bulky and hard to get a hold of? Is it unstable, or could it move suddenly? These are things you need to know before you start. And finally, E is for environment. Just take a second to look around you. Is the floor clear? Is it slippery or uneven? Is the lighting okay? Is the space really tight, making it hard to get into a good, safe position? Running through TILEO in your head takes just a few seconds, and it is your single best line of defense.
All right, so now that we know how to stop and assess the situation, let's get into the how, the practical core techniques you need for any manual handling task. These are what we call the 8 principles of safe lifting. Here they are, the 8 key principles. The most important one is right at the top, think before you lift. From there, it's about using your body smartly. Get a wide, stable stance. Bend your knees. Let your legs do the work, not your back. Keep that load tucked in close to your body. Keep your back as straight as possible, and when you need to turn, move your feet. Never, ever twist your spine. And here's a simple little rule to lock into your memory. Whenever you have the choice, always try to push rather than pull. It's just better biomechanics. When you push, you can use your body weight to your advantage, you can see where you're going, and it puts way less strain on your back and shoulders. Simple, but effective.
Now, all those technical skills are absolutely vital, but in our profession, the load is a person. And that requires a whole other layer of skill. It's a skill built not just on technique, but on communication, on respect, and on empathy.
This really is the most important part of what we do, the human part. People aren't objects. They can be heavy, sure, and they can move unpredictably. They can be injured by poor handling, just like you. But more than any of that, they have feelings. They might feel anxious or vulnerable. They need to feel confident in you. They need your encouragement, and they absolutely deserve to have their dignity respected at all times.
And remember, for every single interaction, your #1 guide, your rule book, must be the person's care plan. This isn't just a suggestion, it's a legal document. It spells out their specific needs, their mobility challenges, and the exact procedures that have been agreed upon to assist them. You have to know it, and you have to follow it. No exceptions.
So what does putting dignity into practice actually look like? It's simple, really. You explain what you're about to do before you do it. You ask them if they're okay with the plan. You make sure doors are closed or screens are used to give them privacy, and you always use professional, respectful, and sensitive language. This is how you build trust, and that trust makes the whole process safer for everyone involved.
Okay, let's pull all of this together now. Safe manual handling isn't a one-time course you take. It's an ongoing commitment you make every single day with every single task you perform. It's a mindset that's built on 3 words: plan, assess, and lift safely. If you only remember 3 things from this whole explainer, please let it be these. Number 1, always assess the risk before you act, using TILEO. Number 2, use the correct lifting technique by following those 8 principles. And number 3, and maybe most importantly, when you are helping people, you must always communicate clearly and care with dignity. Thank you for your time and for your unwavering commitment to providing safe, dignified care. We genuinely welcome any feedback you might have on this training so we can make it even better. As you go about the rest of your day, just ask yourself, what's one small change I can make right now to put these principles into practice? Stay safe out there.
Thank you for joining us at UK Care World. Don't forget to subscribe and come back for new lessons, skills, and insights every week, supporting you so you can better support others.